Welcome back, everybody. Thanks for tuning into my channel. Today, I am interviewing one of my good classmates, Dr. Roshni Vora. She is a practicing attending in anesthesia. So today, we're going to talk about anesthesia. Welcome, Dr. Vora, or Roshni as I call her. Welcome.
Thank you. Thanks for having me.
Yeah, let's start with briefly, give me a brief description on how long have you been practicing, where have you been practicing, and also the brief description of what you do in anesthesia.
Okay. So I'll start off by saying that I live in San Diego, practice anesthesia in San Diego in private practice. I've been out in private practice since 2017, so about 3 years now. And for those that aren't familiar with anesthesia, it's basically a field of medicine that combines critical care, pain, and anesthesia. So we take patients from before surgery and during surgery and after surgery, and we make sure that their surgery goes smoothly and that they're comfortable, and also that they're very safe. And what I mean by that is that we basically are their pilot, making sure that all of their organ systems are doing well and make it through surgery unharmed.
All right. Thank you for that answer. So my next question is, as most of us, when we were med students, did not know what to pursue as a specialty. So how did you come to choose anesthesia, and what other specialties were you also considering?
So I didn't happen to stumble on anesthesia. It was actually recommended to me. Someone said, your personality would be great in this field. And which is funny now that I think about it, because I feel like the running joke in anesthesia is that we all hate people.
Yeah.
But I really kind of think that we're the opposite of that. And what I mean by that is that you're meeting, someone on the biggest day of their life when they're having surgery or procedure, and usually a lot of them are pretty anxious or scared, and you're oftentimes meeting them 5 minutes before the procedure starts, and your job is really to make them feel comfortable, make them feel safe, and so I think that you really have to be a people person. So aside from being a people person, I think that the things that drew me to anesthesia was really the critical thinking involved with your patients. It's one of those unique fields of medicine where you think on your feet, you address a problem, and you turn around and you drop whatever drugs you need, or you get whatever equipment you need, and you do whatever you need to do to treat your patient and reach your desired outcome. So it's kind of one of those unchecked fields where you're not really thinking it through, you're not really writing notes, you're not really waiting, weeks on end for a outcome. It's kind of a very immediate satisfaction in this field. So that was kind of one of the things that drew me in, and it was just nice to be able to work with your hands and think on your feet, and then have that immediate reward.
Okay. All right. And then what other, did you consider any other specialties as well?
So along those lines, I thought another field that's pretty similar in that style is emergency medicine, where you diagnose, you get your results of your study, you see why people are there, you rule out things, and then you kind of start the process for the next physician. And in our hospital, they actually call the hospitalists the quarterbacks. So you're kind of, I guess, the person handing the football off to the quarterback. But and I guess the football is what, the patient. So I don't know. Anyway, probably the lamest analogy, but I thought emergency medicine was pretty cool in that respect. And I thought that was pretty similar to our field, but I liked the aspect that anesthesia offered a very controlled setting, one patient at a time, and you didn't have to divide your attention amongst other patients.
Yeah, that's true, because a lot of my colleagues also consider anesthesia as well, because
Yeah.
there's a lot of overlaps, and we like the procedure aspect with it as well. So yeah,
Yeah.
uh, that's cool. All right, so what is the typical training path to become an anesthesiologist?
So after we went to med school together,
Mm-hmm.
when our lives kind of, reached the fork in the road and you and I took separate paths, I ended up doing a 4-year residency in anesthesia, and then ended up getting a job in private practice. There's different ways that I think you can go about doing it, whether you want to do a fellowship or not. I ended up going into just general anesthesia practice. Whereas if you did a fellowship, you could do a fellowship in various subspecialties in anesthesia, and they're usually about a year to 2 years in length.
Okay, that's awesome. That's my segue into my next questions. What are other fellowships that one could do after residency?
So I just want to preface by saying that a fellowship is not 100% necessary in
Mm-hmm.
anesthesia. And really, if you like the subspecialty and enough to do a fellowship, it will serve you well. But it's not by any means necessary to get a job after residency in anesthesia. But the fields that there are fellowships, there's 2 types. There's the types that are ACGME accredited, and there's the ones
Mm-hmm.
that are not. But regardless of the distinction, there's the fields are critical care medicine, pain management, OB-GYN, or obstetric anesthesiology, and pediatrics, and then the last one being cardiothoracic too. There's various offshoots from that, and in different fellowships popping up, including regional anesthesia and liver transplant anesthesia. As the field's growing and as there's more and more different types of surgery being developed, there's different types of anesthesia that's I guess a little bit more hand in hand with those specialties.
Mm-hmm. Cool. And thanks for the answer. There's quite a bit that I did not know, and I'm sure the medical students probably did not know these as well. So what do you find the most exciting or satisfying about anesthesia?
So what I really like about anesthesia is that we kind of are, I guess, the unsung heroes of the day.
Mm-hmm.
When people go to surgery, they're not like, oh, my anesthesiologist was so great. They're like, they don't even remember your name. But what they don't recognize is that, someone was cutting into them with a scalpel, and there was someone in the back who was their guardian angel. So I like this aspect of, having this silent control over the situation. And I like this aspect of, kind of being able to use what I learned from even med school and residency, but use, you're in charge of the patient's whole body. So all their organ systems. It's kind of nice to practice, how do you treat renal injury, or how do you treat this, or how do you treat that, and address it in a real-time fashion. And when the patient wakes up, they have no idea what you did. And it's kind of this, this, I guess you're just in awe of your own capability.
Mm-hmm. On the other spectrum, what do you dislike about anesthesia?
So I think anesthesia is definitely not for the faint of heart. And what I really mean by that is that it is physically and mentally draining some days.
Wow.
And as you can imagine, that probably happens with every field, but our field is one that mirrors a surgeon's lifestyle. If there
Mm,
is for example, say I'm on OB one night and there's a crush C-section in the middle of the night, that C-section is not happening without an anesthesiologist.
yeah.
So I'm there at 3 a.m. Or if, you have someone that comes in with a stroke or someone that comes in with, a bowel perforation in the middle of the night. These are things that require an anesthesiologist to be able to be there in order for the surgeon to operate. So our lifestyle is one in which, when you're on call at least, is, you're at the will of what comes in the door.
Hmm.
And it can be pretty busy, pretty hectic, and it can be pretty tiring. There's days that, you're back to back on surgeries and you'll think, when is the last time I drank water? Or when is the last time I ate anything? So this is definitely one of those fields that can be very mentally and physically draining. And you kind of have to come to work with that in mind.
Okay. Yeah. It sounds like a pretty challenging specialty as well. So you touched upon the scheduling regarding with surgery OB-GYN. So how does anesthesia shape your work-life balance? You can discuss about you or in general with your colleagues.
So anesthesia is one of those fields where every anesthesia practice does something different. And in my practice, it's pretty complex. We're numbered every day, and you go home when your number is called, essentially. But that being said, we do mirror a surgeon's lifestyle. So if a surgeon wants to do a specific surgery and the patient is cleared for surgery, then we go ahead and make that happen and accommodate. So there are days where you're there late, and there's some days where you're not there late and that it's not that busy. I would say our field is not a lot of shift work,
Hmm.
but there are more and more practices heading in that direction.
Yeah.
But I would say that we do, on average, I probably work about anywhere from 50 to 60 hours a week. Although it doesn't feel like it. Usually, because a lot of your shifts are overnights spent in the hospital or things like that, where
Hmm.
you do have some downtime and you are able to get sleep or do that sort of thing. Or so it's not as draining as what 60 hours a week would normally sound like.
Okay. Okay. Yeah. Dr. Vora just came back from vacations, which I'm currently taking a similar trip as well. But do you get to do a lot of extracurricular activities or whatever you feel like you want to pursue outside work as well?
Yeah, I would say that if if it's important to you, you make time for it.
Hmm.
So that being said, I do have time for the important things in my life, and I don't feel like they are not getting enough attention. But I do think that balancing other priorities in your life will always be a challenge, no matter what field you go into. So I don't think that our specialty is alone in that. And I think that it takes a conscious effort on your part to make sure that you're doing things that you enjoy and that you're doing things outside of the hospital that help you um, stay happy.
Hmm. Yeah, that's very true. You touched on anesthesia being a demanding specialty mentally as well as physically. Do
Mhm.
you have any thoughts on what personal qualities of a student that could make for a successful anesthesiologist?
Yeah, so I think that when you're trying to determine whether your personality is compatible with the field of anesthesia, I think it really comes down to a couple qualities that come out only in crisis.
Mm-hmm.
About 98% of anesthesia is smooth sailing, and really the other 2% is planning for the worst and trying to prevent the worst. And
Mm-hmm.
and then on the off chance that the worst does happen, then it's really that point where the personalities kind of start to distinguish themselves. And I think that as an anesthesiologist and as one that's been practicing now for a little bit, I think that the qualities of a successful anesthesiologist are the ones that they keep their cool under pressure. They
Mm-hmm.
remain composed. They're able to think on their feet. They are very decisive. And I think that those are the qualities that kind of lend to a successful crisis management type of personality. And then the other thing, for 98% of the time, you're planning. And so I think it really just takes someone who has a lot of forethought and has a style of thinking that lends itself towards looking down the road and looking at what can happen and how to plan for that.
Mm-hmm. Okay, thanks for that. So do you see any changes coming to anesthesia down the road? I know it's tough looking 10 to 20 years down the road, but do you see any changes in that?
So I think there's a couple things.
Mm-hmm.
First, I wanted to, I guess, touch on what's happening now, I guess, with COVID. I don't think a lot of us, even when we were in medical school, could have ever imagined something as life-changing as COVID, and as widespread and deeply impactful as COVID happening in our lifetimes.
Mm-hmm.
And so when COVID happened initially, elective surgeries were asked to be halted. So I
Mm-hmm.
don't think that any of us could have imagined also not working,
Yeah.
which was kind of also a blessing in disguise a little bit, because then we were sitting at home and looking at each other, and gave us time to revisit our other relationships in our life, and do something outside of work, develop some hobbies and that sort
Yeah.
of thing. But I think that things that happen like COVID, those are things that we can't necessarily wrap our heads around. And then that when it does happen, now that we have kind of gotten a hold on it, I think our style of practice changes, and that you're just a little bit more careful, you're a little bit more aware of what you're doing, and aware of your own risk with certain procedures and patient interactions, and trying to do things that keep you and your staff safe. In terms of long term, hopefully not another COVID
Yeah.
situation, but if that does arise, I guess now we know how to deal with it. And I think that in terms of the long term for the specialty itself, I think that there is a common thing that's kind of, I guess, that is being addressed at every specialty, no matter what people are going into. And I think that's the issue of mid-level practitioners.
Mm-hmm.
And I know that at least for during times of COVID, I know a lot of states have kind of loosened their restrictions on these mid-level practitioners being able to practice outside of oversight of a physician.
Mm-hmm.
And so I feel like that is going to be a big topic of discussion for a long time. And I think that's going to be regardless of whatever specialty people go into. But I think there will always be this issue of, will mid-level practitioners, eventually take over these physician spots?
Yeah. I think you hit it, and I think it's happening in my specialty as well. So with that, do you currently work with CRNAs or PAs, and do you see that their responsibilities changing down the road as well?
So I think that my experience with CRNAs in particular has been limited to my training, and that we would relieve each other. And we basically were working alongside each other as residents and CRNAs in the workforce. And the CRNAs were also like the residents practicing under the oversight of a physician in that model. And they were working as part of a care team. I think that the roles of, PAs and NPs and that sort of thing, they definitely help to enrich and offload some of the work in healthcare, because there is a tremendous amount of work to be done. But I think that the distinction, when recognizing the distinction between the training level and the depth of knowledge between, mid-level practitioners and physicians, is why there is this pushback against the loosening of their regulations and practicing without oversight. And I think that's also why it's just, because it makes a lot of sense in that mid-level practitioners, at least with CRNAs, don't have as much patient care hours as an anesthesiologist does, as a physician anesthesiologist does. And then also their depth of knowledge is not as vast as a physician, because instead of going to medical school and learning, even pathology and things like that, they are focusing on nursing related subjects when they're training.
So how do you think the job market will be for people wanting to go into anesthesia down the road?
So I think I think that the job market, this is something I even had to look up myself, because I haven't actually thought about that since I got a job. But but I do think that the job market is going to be on the upward trajectory. And the reason I say that is because we have an aging population that will have more and more medical needs. And as the number of encounters increases, there's only so much volume and staff that's available. And that demand is going to be increasing. So I think that once our supply of anesthesiologists is able to meet demand, that's when we'll reach our happy point. But I think that we still got room to grow.
Okay, that's good to know, reassuring for students if they want to go into anesthesia as well. So do you have any tips or number one tips for students wanting to go into anesthesia?
I guess the number one tip I have is get as much exposure as you possibly can in all levels of your training. As a medical student, it's profoundly important to get as much exposure as possible in whatever fields you're considering. That way you have as much knowledge and as much perspective when you're making your decision about what field to go into. And I think that also carries through to residency. Don't pick the easy residency. Pick the one that is gonna challenge you. Pick the one that you're not gonna regret when you come out in training and you have your own malpractice, that you feel comfortable taking care of the sickest of the sick. You want to be the one that's the most prepared rather than the one that wishes they were prepared.
Yeah, that's a very great tip, actually. So with that, do you have any additional resources that students can go find out to learn more about anesthesia?
Yeah, so I think that a really good place to start if you're considering anesthesia is to visit the American Society of Anesthesiologists webpage. There is a student membership that I believe is absurdly inexpensive after looking at my dues. But I think that it's well worth it if you're considering anesthesia as a field. And I think that that's a good place to start. But I think that also use the people around you, use your relationships with a lot of any other medical specialty, because I guarantee you everyone knows someone in their medical school class who went into anesthesia and who is willing to be a mentor for someone. So I think that those are kind of good places to start to get your feet wet and really kind of see what the specialty is all about.
Okay. Thank you for that, Roshni. Do you have anything else to add that students should know?
I don't really think so. I don't know. Is there anything that you can think of?
No, I think those are all the questions I had regarding anesthesia. Okay.
Yeah, I
Thanks.
think we covered.
Yeah, that's quite a bit of information. So thanks, Roshni, for volunteering your knowledge and your time. I know it's very precious to you. So thanks for doing this with me.
Yeah, thanks for having me, and good luck to you for the rest of your trip and all your hiking, and good luck to all these medical students as they're kind of, coming of age and trying to decide what specialty fits them. So I
Yeah.
hope everyone the best of luck.
All right. Thanks.